I want to thank Bridget and Emily and Dave and pretty much everybody who pulled together. There's a lot of people who are presenting this week, and I'm real excited to see everybody's hard work pay off this week. A little bit about MIE in the background. We're 23 years old this year, 23 years old. And many of you guys have been around for more than a decade. So it's exciting to see how MIE has kind of weathered the times, the good times, the bad times, and have grown to this day today. A little bit about MIE. It's the medical innovation engine. It's kind of the kernel that started everything. It's mostly R&D, medical informatics engineering. Boy, that really just rolls right off the tongue, doesn't it? But it is the geeks and the people who love computers and technology that kind of make things run. We were really in the cloud before it was a cloud. The first development of WebChart was in 1998 as a web-based tool. As we first built a telecommunications network which was based on the internet back in 1995, and then in 1998 someone came and said, "Okay, now what do we do with this thing that we built?" And so then it was, okay, let's develop web technology that sits on top of that network and lets doctors communicate. At the beginning, in the onset, it was meant to be an interoperable platform, meaning two WebChart systems should be able to communicate and exchange data, which back in the early 2000s was kind of revolutionary. Netscape went public, I think, in 1995, right at the founding of MIE, actually. So, and MIE actually represents the R&D arm. That's where we basically keep enhancing our technology, and where the engineers kind of pour their passions into the computer and hopefully makes physicians, providers' lives better. But MIE is going to be kind of in the background. WebChart, which a lot of people know, started, like I said, back in early 2000s, 1998 to 2000 timeframe. It's kind of the first web-based electronic medical record. And out of that came No More Clipboard in 2003. We wanted patients to start participating in health information exchange, just like physicians do. And then out of that was the marriage of both the personal health record and the medical record for occupational health care. And in fact, 2003, 2004 timeframe, Dow Chemical became our first client and decided to say, hey, we'll teach you how to do occupational health. And we want to deploy it in 7 countries. And we want it web-based because we don't want to install servers everywhere. And that was the birth of Enterprise Health. And then our recent, and we'll talk a little bit more about this today, is Bluehive, which is kind of going back to the idea of No More Clipboard, but taking the enterprise health technology and simplifying it and making it very easily deployable. And we'll talk a little bit more about this here. So just a little bit about the state of healthcare today. This if you haven't seen this is ZDogg MD, but it's a very good way to actually kind of talk about the way physicians and providers feel about healthcare. Oops.
Recorded, takes up with the ward clerk. Turned diluted to dilaudid, switch me to that EMR. Meaningless abuse, G. Now catch me at the nurse's station, matching that F2 key. Notes used to be our story, narrative, but yo, replaced with copy paste. Now uploaded ransom note. Me, I'm at that bedside, focused like a laser beam on the patient. Now come on, I'm treating the computer screen. 8 dozen warnings, click check boxes. Alarm fatigue, Vaseline conflicts with Doxy. Nurses, they be burned out. We could use some OT. Tell by our wrist guards that we most definitely Best practice pop-ups with Zion. You we need a new job. You're welcome. She built you a turd, doc. Catch you on the phone with ID, making text.
Let's talk to any physician out there today, and they'll just say amen, 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 right? So he's a fun guy to follow. So WebChart was built on the premise to make doctors cognitive, not clerical. And one of the early things that we did was basically scan in paper charts. Where, WebChart is a document management system at its core, and I'll be talking a little bit more about that later in the fundamentals. But our main goal here is to try to make it easy on physicians to treat patients, to save lives, and stay out of their way, to be honest. Make it easier to document the care and communicate that to the next physician in the line. Because, what's amazing about healthcare is it changes every day. So there's some new innovation that comes out that fundamentally changes our understanding of what disease is, what health is. And WebChart's job is to try to help make that easier for the physician. So we've made some new additions, actually. WebChart's very much a key priority for myself. It's where my passions lie, is in clinical medicine and making an impact in clinical medicine. We've actually made some new additions to the WebChart team. We're going to be expanding the focus and effort on WebChart. We actually are completing our advanced certification. I think in 2016, there was 900 products certified as electronic health record. I think there's something like 30 now. So we're seeing a massive consolidation in the clinical electronic health record business, which is good, actually. And then we're also developing new partnerships, like resellers, for example, to go out there and do implementations of our system. And we're also pursuing very large opportunities. For example, a lot of you guys know Wyoming, the state of Wyoming licensed WebChart for every one of their physicians in the state. Now, of course, Wyoming has 500 physicians 1,000 physicians in the whole state. So, but big deals like that are what we're going to go after. One of the areas that we're going to focus heavily on here is on mobile in the coming year or so. And actually, this is a screenshot of the apps actually in the App Store today, actually, and installing them on your device. And what we're going to do is we're going to do a little live demonstration here of WebChart on a mobile device here. And what we're doing here while he's setting up is we're trying to make the electronic medical record be something that can be in the hip pocket of the physician. That they can. One of the things that we found is that physicians don't like to go in with clamshells and work at the computer when they're with the patient, and that it interferes with the experience. The patient feels like the doctor's treating the computer instead of the patient. So a lot of physicians don't use technology when they see the patient. Instead, they go in, they do an interview, they write some notes, and then they go out and then they have to document their record, the visit actually out in the hall. And that means that double the work. Now they're actually having to do it twice. So we're going to be investing in this kind of technology, and what Will's showing here is actually setting up WebChart for the first time on the device, including using fingerprint recognition. So once you credential and set yourself up, including using your fingerprint, boom, now you'll be able to get into WebChart with just the push of a button. So, and this will work with Face ID, as well as he's going to go back in now into WebChart and just use his thumbprint to get in. And then boom, up comes WebChart. So, and the credentials are securely stored within the device, within the Touch ID or the Face ID sensor, and it makes it very easy to get into. And the UI team has been working very hard to, it's clipping on that screen over there. There we go, yeah, turn sideways. To make all of the screens work very nicely in a pocket form. So in the next things that are coming, this actually will be in the store here, probably within the next 2 to 3 weeks. Right now it's in a beta mode that allows us to share it and invite people to test, and we'll be sending out invites next week or the week after for everybody to test it on their devices. And but then with a wider rollout with dictation, the ability to upload photographs, for example, take patient photos and things of that nature, all kind of embedded in the device with zero installation. Good. You showed WebChart?
Yep. You want to show Bluehive?
Yeah, let's. We're actually going to be talking a little bit about Bluehive in a moment, but we thought we'd just show the app while we're here. Bluehive, the app, is going to be launching in just a few days. So that's actually the app here blocking you from being able to get into it. And then we'll show here Enterprise Health as well. And we're going out with each of these brands because it kind of goes after a different audience. The app, the technology underneath it is still kind of WebChart, but we're branding it for the audience. And then there's No More Clipboard as well. So that'll be exciting when doctors can sort of take call from the couch and be able to place phone calls and receive phone calls, know which patient's calling or things of that nature, all from the device that's kind of in their pocket. So a little bit more about WebChart and the R&D that's going into it. Obviously, we just did a quick demonstration on the mobile. Another area we're investing in heavily is in security. Obviously, 2015 was a bad year for us with the incident that took place back then. So we've invested heavily in the two-factor authentication, and we're deploying more of those kinds of security measures out for our clients to take advantage, so they can actually do two factors, so they can use the thumbprint to actually get in. And also, in addition, alerting the system administrators about people who are logging in who might not be them. We've invested heavily in data analytics. There's going to be a presentation here this week about reporting and the new visualizations that we have in reporting. You know, an electronic system is only useful if you can actually use it to report on and actually gain insight. And so data analytics is where it's at today. We're also going to invest heavily. We're actually in a pilot right now with voice recognition, and not just, kind of bolted on voice recognition, but the ability to actually dictate and the system to know where you are. So if I'm in the medication section and I'm dictating medications, it's not going to start thinking that I'm dictating conditions, for example. So right from the device, being able to whip it open and be able to dictate a note and make that very easy instead of pointing and clicking, as Z-Dog likes to say. Device plug and play. So several people understand that when you're doing audiograms and PFTs and taking blood pressure measurements and things of that nature, it's kind of a hassle to be plugging in all these cords and everything into the devices. So with using things like Bluetooth Low Energy, you can walk up to a device and start reading information from it. So we really want to make the mobile device, and we're actually, Dave Cornwell's establishing an interoperability lab at our offices so we can bring in devices and rank only the best ones, meaning the ones that I can just walk up and just use my device and then have it start reading data without having to do any configuration or installation or things of that nature. That will be the gold star standard of the way we interface with devices. And then you get like bronze and silver and dirt if you can't. Some of those out there. Okay, and then telemedicine is an area. In fact, we're actually working with one of our partners here to pilot the idea of doing telemedicine through the device, being able to use technologies like WebEx or FaceTime to have real-time interactive sessions with patients out in the field. This is very interesting, particularly in the occupational health setting where we have a lot of professionals sitting at desks, and why should they get out of their chair if they can just see the physician? Now, there's probably lots of good reasons for them to get out of their chair involving health, but if you can just have an instant visit with the physician, why not? And then lastly, an area that I am passionate about, I actually have some papers published on artificial intelligence from back before I started MIE on using using neural networks to classify EKG signals. And so this is an area that I want to invest in heavily, is using everybody's talking about AI. And so with voice recognition and some of our data analytics, what we want to do is start putting artificially intelligent systems in place to help look at, for example, what is the best, potentially best restrictions for someone with back pain, and things of that nature. So we want to, and we actually have a decent amount of what we would call machine learning, what are called Bayesian inferences with our autocompletes and things of that nature, but we're going to continue to expand it and make WebChart even smarter. Oh, yeah, sorry. And the last one here, and this is something I'm passionate about, I want to see genomics start to get wrapped up into web charts so that as a lot of this genomic data comes out, instead of taking a family history, you basically spit in a cup and then now you know the whole family history. You don't have to ask those questions, and there's so much data that's coming out that physicians are not capable of processing, and no human being can process the genome information of one person, let alone their whole patient population. So we're going to invest heavily in the genomic side. So that's WebChart. We're going to talk just briefly about No More Clipboard and what's going on with that. For those that aren't aware, No More Clipboard is basically WebChart, but reskinned for a consumer experience for patients. And it allows patients to own and control and manage their own medical record. Anytime you have a physician visit, you can push that information into No More Clipboard, and the patient owns and controls that information from there. And No More Clipboard is going to be getting a massive facelift here in the next couple of months, basically benefiting from all of our portal technology. We're going to basically redeploy the employee portals that we have in Enterprise Health and that technology into No More Clipboard and modernize it. I'm going to go quickly through this, but I still believe that there's a long-term growth strategy here for patients to own and control their own medical record. And even as we look at occupational health and clinical health, the marriage of those two environments. I mean, there's an awful lot of patients out there that are exposed to occupational health today, more so than are in clinical medicine, because they're healthy, they're working, and the vast majority of people are healthy and working. It's that something like 95% of the healthcare dollar is spent on 10% of the patient population. Well, our occupational health record can help feed that clinical record when people do get sick. So then we'll talk a little bit about Enterprise Health here. Enterprise Health is taking WebChart and No More Clipboard, basically, and putting it out there for employers to use. And we're targeting employers, mostly the largest employers, to manage the health and wellness of their employees on staff. And this shows just an example of some of the clients that we've brought on over the last 10 years. Some of the biggest names on the Fortune 1000, right? Many of these deals took 3-4 years to get up and millions of dollars to implement. Millions upon millions of dollars in some cases for these employers to implement and deploy. You know, Chevron's in 44 countries, for example. These were exciting. These taught us a lot about what it takes to scale up our deployments and put them out everywhere. Just in the last year, though, we've actually implemented all these logos. So we're starting to accelerate the process. Instead of years, now it's months. So I think it's not on there. Prudential, for example, I think went up in 6 months. Yeah, it was in the prior slide. And this is great. And then, of course, we have some things on the horizon here. These are where we've actually been chosen as a finalist to deploy. And these are deals that are actually on the horizon right now, where there have been pitches, and we haven't been selected yet, but really, really good chance. So a little bit about Enterprise Health here. Enterprise Health kind of sits between environmental health and safety and then corporate health and wellness. You have a lot of HR departments out there who have to provide benefits like insurance and dental and things of that nature. And then you have a whole team in some of these organizations where they're going out and doing environmental studies within their buildings to find out what kind of noise is out there. And Enterprise Health sort of sits right in the middle of that. And it offers a compliance piece to remain compliant with the record keeping standards. Also just regular occupational medicine, and then employee health and wellness. And we're not going to spend a lot of time on this slide because we're going to talk about it over the next week, but all of those components are kind of in these verticals. Everyone should have seen this. I think it's affectionately called the rainbow graph right now, or the Skittles graph, I think. But all of these represent some piece of functionality, and they're in these verticals because these are all the employer modules. These, and over here are all the occupational modules. And then on the right here are the kind of employee health and wellness modules. And there's dotted lines there because there should be separation. It's the employer doesn't need to know about somebody's diabetes way on the other side of it. So the employer just needs to know things like the work status, like is the person cleared to do the work that they're doing. So more on this in the near future, but what we're doing is taking the web chart, the electronic medical record right here, and we're skinning it for occupational medicine. So again, MIE is kind of in the background here, kind of feeding these brands. Sorry, I forgot to talk about Blue Hive. We'll do a little. There's been a lot of interest in Blue Hive because it's been kind of. I think it was back in September. This kind of was my little skunkworks project to basically take what we've developed for enterprise health and deploy it to employers who can't afford to plop down maybe $1 million or a couple $1 million for an implementation. So we had a strategy meeting where we decided, okay, how do we have a lot of interest from employers that just can't make that investment. How do we do that? And Blue Hive came out of that. And we're really targeting employers. Blue Hive is for employers, and it's essentially a very simple and easy way to do occupational surveillance, medical surveillance. And what I'm going to do is do a little quick video here.
This is a story about a bee, a worker bee. This bee, our bee, was a French bee who worked near a recycling plant, biogas recycling plant. And this recycling plant processed waste from, among other things, a candy factory, an M&M factory. Our bee and all his friends, doing what bees do best, came upon this sugary blue utopia. And the next thing you know, we're producing blue honey. The parallels of this tale to occupational health and the important role of this medical specialty in linking exposures, in this case blue ingredients, to outcomes, blue honey, lends itself to the notion of an occupational health hive, a thriving provider marketplace, an ecosystem, where health and service providers, health IT applications, employers, and employees can congregate to manage and enhance occupational health and compliance. Introducing Blue Hive, the online occupational health ecosystem.
Morgan did a great job with that. And narrated it well too. So what we're shooting for with Blue Hive is a really frictionless experience where there's almost no setup. Again, marrying the mobile concept here with seeking out medical surveillance for your employees. It's an opportunity to kind of, reshape the landscape for smaller smaller employers to basically find providers to provide medical services that can't afford to have those physicians on staff. Like Enterprise Health is targeting any employer who has a full-time physician on staff. Now, the vast majority of employers can't afford to have a full-time physician dedicated to the health of their employees. And so Blue Hive is going to try to connect up providers out there, for example, ReadyMeds and the Concentras of the world, with employers, smaller employers that need to find those providers. It's a truly SaaS offering, and we're going after millions of employers and tens of thousands of providers to connect them up. And so there's actually a website, bluehive.com, that's launching here in just a few days. And this is kind of the employer pitch as well as the provider pitch here. So we want to recruit both sides of it. And so it's very similar to like an Uber, where Uber wants to connect up people who need rides with people who have cars. And that's essentially the idea here with Blue Hive, is to make it so that we're just facilitating an exchange between two parties. So again, think Uber for medical surveillance. And just to give you an idea of what it looks like for an employer, what that process looks like, I've got another short clip here.
Welcome to Blue Hive, the online occupational health ecosystem. Blue Hive was created to streamline the work of occupational health and wellness. And it's easy. To start, just search for provider by zip code. And, just like that, see who's available in your area. All for free. To really see Blue Hive hum, sign in with an account. Or, even easier, sign in with Google. Once you're logged in, all of your pending and completed orders are easily accessed. And ordering a new test is just a few taps away. Just select an employee, or quickly add a new one. Then select what you need from the preloaded menu of procedures. You can even save frequently used tests for quick access later. Finally, choose a provider based on things like hours, location, services, or ratings. You can filter the results to help narrow the field. Just confirm and place your order. It's that easy and that quick. Blue Hive, the online occupational health ecosystem.
And what we're targeting here is really just the medical surveillance component, the things that OSHA mandates that you have annually or every other year for employees that are exposed to certain risks in the environment. We're not doing injury care. We're not doing OSHA 300 recording and reporting and things of that nature. A lot of the features that Enterprise Health, that huge grid that I showed earlier, the rainbow grid, we're only talking about a small sliver of that functionality that we're going to be offering in Blue Hive. So MIE is behind the scenes powering each of these brands. And we hope to use those brands to really make a dent, and what I'm going to do here is I'm going to turn things over to Dave to talk about how we're going to do that.
I'm just so impressed by sitting here in the audience and listening to Doug, because we just got a glimpse of Doug and what's in his brain. And it is amazing. And the thing that I look at that, I go, wow, how are we going to implement all that? How do we as a team execute on his vision? And that's the thing that I think a lot of us struggle with. Especially I do when I get calls from Doug at 11 a.m. at night or 11 p.m. at night going, hey, I want to be able to stand up WebChart in 5 minutes. That was back in 2010. So let's talk about scalability, sustainable growth. And we're going to talk a little about our roadmap here. And, my responsibility is at a technology stack to get us to routine. And Doug has said that many times in our presentations before about what does routine look like? And right now we want to be able to embracing our own concepts. Executing vision is difficult, especially when we're a company that's wanting to grow and we have a lot going on. We're adopting new applications. We have an initiative called Quote to Cash that's going on. Everyone's probably heard of that. I'm going to be talking more about that later this week. We're improving project support and management, the tools that we're using, collaborative tools. We're improving sales and marketing tools. Well, what does this look like? There's a lot going on. And if you guys think about the departments that are within NMIE, there's a lot of them. There's account management, there's HR, there's sales, there's tech support, there's development, there's DevOps, there's SecOps. There's a lot of the departments that make this engine go. And just take a moment and think about that, because everybody needs to really pat themselves on the back, because without you, we can't execute Doug's vision. And we've done a great job up to now, and we were on the launch pad to really make to the next move here. So what does this look like? Well, we're working to deploy new tools to take us to the next level in a standard approach. So we're using things like HubSpot, Smartsheet, Slack, the Atlassian product suite. We're transitioning our payroll to ADP. We're forklifting our financial system from QuickBooks to Sage Intacct. And the one thing that you're missing here is that these are a lot of point key products that do a really good job at doing something specific. For example, Smartsheets, awesome at project management. But how do you communicate the smart sheets? How do we go from proposal to invoice? And that is really the next thing here. And if this works, there we go, is where you have this continuous integration loop of communication. We're looking at bringing these products together and streamlining the process from quote to cash. And what this means is that when Kyndryl needs help in selling a product line, he doesn't necessarily have to go search the S Drive, search Google Drive. The information's at his fingertips. And that's going to help us deliver our products faster, deliver information to our clients quicker, and provide him what he needs faster. So, this portion of it is a very big step for MIE. We have all these departments that need to communicate between each other. And we're going to be rolling a lot of these things out. And a lot of you have been beta testing, like, for example, Confluence and Jira, Service Desk and Smartsheets and HubSpot. And I want to say thank you for that, because you're really that grassroots movement that's kind of catapulted us in the direction that we need to go. We've taken a lot of time to really think what the best solution is from us from an integration standpoint across the departments and deployment. So let's talk a little bit about infrastructure here. Our customers, our Fortune 500 customers, over the last 5 years, and Doug's mentioned security and cybersecurity, has taken hold on the direction that we communicate with our customers. It's typically the first thing that comes up once we get past that sales demo. Once Bridget sells them on it, which only takes probably 20 minutes, and they're like, "Oh, sign me up." If you sat through one of her demos, it's amazing, and our customers love it. The next thing that comes along is the procurement, the deployment of the infrastructure, getting the customer comfortable with giving their data to us and deploying it in a highly secure environment. And Doug had mentioned about this, and security is taking a big portion of that. And Andy Horner is going to be speaking more about what we're doing in a compliance standpoint and a deployment standpoint to ensure that our data is secure. It's a full-time job. We have weekly meetings with DevOps and SecOps to talk about walk the wall. It's a full-time job, and we work really hard to do that. So what is this? MIE offers hosting environments, and this slide came about I don't know, eight months ago, and has kind of grown from there. But it describes our infrastructure hosting options to provide to our customers to get them comfortable with hosting within MIE. So we have, for example, the extranet, which is everybody knows is the current WebChart deployment. But what we've done is we've added different pillars. We've added the Minimax solution, the Supermax solution, the fully encapsulated solution, and then on-premise and FedHealth or FedRAMP. I want to take a brief moment and talk about Minimax. And everything that's in the different shades of red is a level of additional security in the sense of data encryption at rest. And this is what Minimax is. Now, a lot of you are probably looking at this going, "I don't know what's going on here." But these are the slide decks that we present to our customers that are asking us to provide some information at a security standpoint. This is a lot of effort by a lot of different people to get them comfortable with the solution. And we've taken a lot of time to provide these new environments to host applications such as Enterprise Health, WebChart, and soon to be Bluehive. So new approaches. So Doug talked about standard, Bridget talked about standard, we talked about the standard project plan. All these things are becoming standard. And what does this mean? It means that we're able to deploy our product quicker, faster, and provide routine deployment of WebChart, Enterprise Health. And it also means the on-ramping of new employees is faster. They have a place to go. They're able to find the information they need. It's not a different standard. It's not a different project plan for every single deployment that we do. And I got to thank Doug for throwing this in here because he nailed it. The client asked us to redesign it. We're taking time to stop and think about, hey, why are you wanting to do this? who's asking for this? Is this something we need to do at a strategic value? What's it do for me as a company? And this type of approach, standard approach, and really asking the 5 whys is a part of this whole new deployment that you're going to see here in the next few days with Quote to Cash and the products that we're going to show with that.
Yeah, the only way we can execute is by having repeatable plans in place, and that everybody here be familiar with that standard approach. I'm not happy being the best kept secret in healthcare. I hope you guys aren't either. I feel like, and when people, when we do a presentation, I hear this almost every time that we do a presentation. Where the heck have you guys been? Or, I can't imagine that this exists. And there's a couple times where they actually have said to Bridget or to Jeff, we don't believe you. We don't believe you can do the things you just demoed, even though you demoed them. So we're investing heavily in sales and marketing in the coming year. And that's what making a dent is. I mean, it's taking the technology and the investments that many of you guys have made in your years. I mean, it's decades, some of you, and decades definitely for me, that have invested in WebChart and MIE and doing something with it that makes an impact. So you can get up every day and tell your kids that you're helping to improve healthcare. So where do we go from here? Again, simplicity and elegance. We're trying to cut out things that are not simple, that are not elegant. And that takes work. It's actually harder to become simple, to become elegant, than it is to just keep adding more switches and capabilities on. So what you're hopefully going to see, and I want to have everyone's commitment here, is that we want to simplify and make things more elegant. And of course, that's going to lead to scalability and repeatability. The simpler it is, the more intuitive it is, the easier it will be for people to understand what it is that we're trying to accomplish and then get on board. And that's going to allow us to make a dent. Thank you very much. I'm looking forward to a great week. Appreciate everybody's attention. Thank you.